with liberty and justice for all.
All right, our first call to the public. I have one slip on Joe Schneider.
Hello, I'm Joe Schneider. This is regarding the old DAV van. I am junior vice of the state for DAV. I am requesting you guys to take control of the keys until the state department get done with their investigation. And after we get done with our investigation, I will let everybody know what our decision is. But as this moment, I would like you guys to take the keys and hold on to them, because bad weather, we don't need the wrecked car. That is national property, not county's. Thank you.
Thank you. Anyone else for our first call to the public? All right, hearing none, we'll move on to our first agenda item. Consider authorizing the health department to contract with Dr. Dennis Chernin for medical director services in the amount of $37,200 from 1/1/2020 to 12/31/2020, and authorize the board chair and health director to execute the documents.
I'll make the motion. Second.
All right, we have a motion and a second. Any discussion?
No, I think we need to be forward thinking.
Larry's looking after you, looks like he's doing a good job, so we'll just.
Yeah, but I think we need to be forward thinking in the fact this person's been here 35 years, sure. It's not the future of where we're at. We're in a position now with a new health department and a new building. We can attract more people. I don't feel, as a member of the health board, I've seen what this individual provides our county, period. I mean, except to take $37,000 from us every year and come here on a very minimal basis. So I'll be very enlightened to January to see him come to the health board and explain what exactly he does, but I just think in our position now that when we run out of Medicaid funding, which, you know, we ought to be used to the fact that we're gonna be paying more for somebody, but paying more for somebody that's gonna be here and provide us the services we need, I think is something we need to think of. I see Larry's jumped up. I know him and I have been having this discussion already, and he's prepared to, he needs another year, but, and I'm sure we'll give him another year, but I voted no at health board, and I'm gonna vote no again, so.
Larry?
Just to comment on what the commissioner was saying, there are discussions about the long-term position and where we're going to go with it. Obviously, Dr. Chernin has been here since 1986 with the health department, so this will be his 35th year. That's not a long-term solution going forward, and I'm aware of that. Having said that, you know, we're going to do the respect of you know, working with him and whether or not we transition to something different next year. Be that as it may, we may be looking at doing that. I will say that there is a shortage of medical directors in health departments around the state, and Ionia County is having trouble filling the position right now, and they're in the $50,000 range for medical director. It is a position that's required by state law. We absolutely have to have it. It's in the public health code. It is a very part-time position. It's basically an 8-hour-a-week position, but it's very important to have a medical director to oversee the medical aspects of the health department as far as like nursing services, signing standing orders, and then just being a consultant to the health director. When we have an outbreak of hepatitis or EEE or whatever, this person has to be on call 24/7. And so I understand the concerns. They're duly noted. They've been discussed at health board also. And you know, for right now, I would recommend that we renew the contract for 2020 and look at the future of where we're going to go with it. Sometime around the middle of next year, we get into the budget. So that's my recommendation.
Right, and being that it's December 10th, it would be very difficult for you to try to come up with something On that short of notice, correct? You know,
Yeah.
try to fill that.
Yeah, it's gonna take time to fill it.
What do you think, so? My fear is I just want us to be prepared that the cost is going to go up. Dr. Chernin is not going to be here forever. The cost is going up. And the thing is, Larry can pay for it now because Larry has a lot of funding in the health department. What happens in 2-3 years when Dr. Chernin no longer wants to do this, and we are now supplementing the health board or the health department because we don't have all the Medicaid reimbursements and funding we're receiving over there for them to operate on a more independent basis. So I think him and I think us need to be prepared that 37 is not paying for a health director or a medical director. So we need to be prepared that that money's going to be probably 60, 70, 80. It's going to be higher, and it'd just be smarter for us to look forward to that, because if we have to subsidize, where are we going to come up with that money? Wouldn't it just be nice to be prepared?
Madam Chair, can I ask a question?
Absolutely.
So, I would say, I don't sit on this committee, I'm not voting today, but I'll be voting on Wednesday. If the appointment continues, then what's the plan? I mean, have you thought timeline for next year? Or, I mean, so we're not waiting, we're not having this, if we do proceed with this as a board, we're not doing this again next December.
Right.
Are you thinking,
I will have to get into this in the spring for certain to start the process, especially if it's gonna take a long time to recruit. Seeing what I'm seeing around the state with the difficulties that UP is having trouble filling one position for all of their counties up there. Now that's a different area. But most primary care physicians are in private practice because it's more lucrative. So and there are special requirements for a medical director. They have to have a master's in public health in addition to their MD or DO. So it really narrows the pool. It is going to be more costly, but I do agree that the long-term plan is going to be a change in that position. So I would say, to answer your question, that spring we need to start looking into it so we can build it into the budget, which I usually start working on in early summer, and then hopefully to have somebody in place for January of 2021.
Madam Chair,
Yes.
if I may. What are the options for any type of contract less than 1 year? Let's say 6 months or 4 months.
That's a possibility. And what that would involve is potentially sharing a medical director with another county, which is not uncommon, because the state does help facilitate the process of getting a medical director. And so maybe some sort of a temporary coverage thing might be something we look at if we can't find someone. But, you know, I'm confident that we'll be able to come up with something.
Is there any way we could do that now?
I would recommend against that. Because, I mean, we're already up to January 1st. I gotta have somebody in place.
We contract him for 4 months, give you a quarter of a year to find someone new?
Well, after 35 years, I'd rather handle this tactfully, if you know what I mean.
That's all I have.
All right, anything further?
I have a quick question. Do you feel like he is fulfilling his services? I mean, you have gaps that he's not covering? Things that a medical director should do that aren't being done?
He's very experienced, he's very knowledgeable, and he's valuable in that respect. Is it something where I feel like he's a big part of the programming? No, I don't. So there's some agreement here that we're gonna have to move forward eventually. I'm just not ready to do it at this exact moment, if you know what I mean.
But at 8 hours a week, is anybody going to be a big part of the programming?
Well, it depends on
Yeah.
who you get, what you get. Some medical directors are very active, but some are also full-time. For instance, Clinton County has a full-time medical director that's shared with other health departments, but they're paid at the level of a primary care physician, which is obviously something that I can't do. But that's a full-time person that's involved in community planning, they're involved in direct primary care services at the health department. So potentially sharing that type of, platform for a medical director might be very beneficial. So, and right now we do share Dr. Chernin with another county. He is also the medical director for Lenawee County, which is south of Ann Arbor. So yeah, I see where we're going. Just need some more time.
in favor of advancing this forward, please say aye.
Aye.
Aye. All those opposed, the
Aye.
same. All right, motion carried. Consider authorizing the Health Department to contract with Michigan Department of Environment, Great Lakes and Energy for environmental health services in the amount of $37,766 from 10/1 of 2019 to 9/30 of 2020, and authorize the health director to execute the documents.
Support that.
Second.
All right, motion and a support. Any questions?
This is a contract renewal, slight increase over last year for environmental health services, campground inspections, public swimming pools, public water supplies. There are a number of the services that are under this contract. It's about a $600 increase over last year, so not much, but a little bit more. And that is funding environmental services.
All right, any further comments, questions? All those in favor of moving this forward, please signify by saying aye.
Aye.
Aye. All those opposed? Motion moves forward. Consider reappointing John Pytosh and John Morbitz to the Shiawassee County Health Board for a 3-year term from 1/1 of 2020 to 12/31 of 2022, or until a successor is appointed, and authorize the board chair to execute the documents.
I'll make the motion.
I'll support that. We have a motion and a second. Any comments, questions?
They're basically reappointments that are currently serving on that board, and the health board did send them over as a recommendation.
I don't even think we had other applicants.
Okay.
Those were the only two.
All right. All those in favor of this signify by saying aye. Aye. All those opposed? Motion moves forward. Consider appointing Chris Plahoon to the Sanitary Board of Appeals for a 4-year term from 1/1 of 2020 to 12/31 of 2023, or until a successor is appointed, and authorize the board chair to execute the documents.
I'll make the motion.
Second.
Any questions? All those in favor, please signify by saying aye.
Aye.
Aye. All those opposed? Motion carries forward. I am looking at this though, 2023, is that 4 years? 2020? I'm gonna circle that, maybe we can just double check that. Consider reappointing Cody Baker, representing solid waste industry, Dennis Braid, representing general public, Melissa Higbee, representing environmental interest, and Chris Plahoon, representing general public, to the solid waste committee for a 2-year term from 1/1 of 2020 to 12/31 of 2021, or until a successor is appointed, and authorize the board chair to execute the documents.
Support, I'll make that motion.
Second.
All right, we have a motion and a second. Any questions, comments? Hearing none, all those in favor, please signify by saying aye.
Aye.
Aye. All those opposed? Motion moves forward. Consider reappointing Ralph Reingans and Sandra Mahalik to the Valley Area Agency on Aging Board of Directors for a 2-year term from 1/1 of 2020 to 12/31 of 2021, or until a successor is appointed, and authorize the board chair to execute the documents.
I'll make that motion.
Second.
We have a motion and a support. Any comments on this appointment? All right, hearing none. All those in favor signify by stating aye.
Aye.
All those opposed? Motion carries forward. Consider appointing Jim Carruthers and John Pytosh to the Veterans Affairs Committee for a 4-year term from 1/1 of 2020 to 12/31 of 2023, or until a successor is appointed, and authorize the board chair to execute the documents.
I'll make that motion.
I will support that. Any comments, questions? All right, all those in favor signify by stating aye.
Aye.
Aye. All those opposed?
Aye.
All right, motion carried. Any other agenda items to come before this committee?
Actually, I would say something, it's not really this committee, but we didn't have public safety in courts today, and the sheriff did hire an emergency manager. We were going to have him introduced tomorrow, but the sheriff now has an engagement tomorrow that he'll be out of town, so probably won't get an introduction to him until January. His name's Jeffrey Weiss, comes from Ingham County, he's a 20-year deputy from Ingham County, he served as their emergency manager, I believe, for the last 5 years. So he is still a certified and sworn officer too, so he will act sworn under the sheriff. So he will have an emergency manager and basically a law enforcement officer that can act and can assist or back up our sheriff's deputies if needed on call. So
Is that part-time, full-time?
it is part-time. It's part-time salary. The guy's retired from Ingham County. He's not looking for full-time. Part-time is perfect.
How many hours?
I believe it's going to be 29.
I think it's 24.
24.
$40 per day.
But he's got, he does have a lot of experience, a lot of background. He was gonna be here this week, but now that he's not, I just wanted to let everybody know that we do have somebody, and he'll be here in January to introduce himself. Jeffrey Weiss.
WEISS.
All right.
Oh, and one more thing too. I did get an email, I think all of us probably did, from City Manager Corona. The Pleasant View has been sold to Finley Green. They are a veterans organization that houses and services veterans, so they'll be putting in over $1 million+ in refurbishes and remodels to the current facility. And they'll be looking to service any needs for veterans, homeless veterans, or veterans in the area now. So hopefully that'll be something that'll help out. We've been looking for that.
What was the name of it?
Finley, I believe it's Finley Green.
Fiddler's Green, I think.
Fiddler's Green? Yeah, that might be.
Fiddler's Green.
Yeah.
Yeah,
They're
and
gonna put-
they're
they're leaving
finalizing it in January of 2020, and then the place should be open for business, they said, in mid-year.
Mid-year, and they're gonna finalize January, open by mid-year, $1 million in renovation, I believe is what it said. So,
Fantastic.
That'll be good. That's all I have.
All right, thank you. Anything else? Brandon?
Do we want to talk about as a committee, the truck issue? Whether it is an issue, the legalities of it?
Well, I talked to Mike Nations today, and he said that Mike Reeves was chasing down the paperwork. So they're gonna see, they said if it's a mistake and an error on their part, they'll clear it up. You know, that they want it to be known that, again, it was not us or the county that gave it away, it was the Veterans Department that thought they were helping another department. So if they can track down paperwork, Mike Reeves seems to think he has paperwork that said they can do with whatever they want with it. We'll have to see if that ever comes to be true. I mean, we don't know if it is or not, but we certainly gotta wait to see if that comes through. But they are looking into it, and they said if it is not meant to go to them, they will correct their error. And I don't know that we're acting on it. We should let them, and we should let the DAV kind of communicate together, and they can work that out. I mean, the commissioners didn't say give that van to probate, you know, that was anything to do with us. So I think if the Veteran Affairs Office made a mistake, they're willing to correct it. We need to let them correct it and work with the DAV to figure it out. We need to stop being the middleman between outside organizations and our departments. We just let them do their business.
That's the
Yes.
point,
So
the
on that
reason
note-
that you got put into that
No,
seat.
Joe, you're gonna wait till
So
public comment.
on that
Thank
note,
you.
if that transaction does not occur, there are 2 other vans, that I've had department heads speak to me about that are willing to work with probate. So that's, as a,
good.
one is kind of internally here in the county, and the other one is kind of an extension of our county government, but they're both willing to do that to help assist with budget needs and everything, so probate can, have a transportation vehicle. If it comes to that, we can have that discussion.
Okay.
And that would be the sheriff, and then that would be the director of Pleasant View. Both have offered assistance.
So we've got other alternatives if we need to.
Correct.
And mainly for end of school, summer activities for children
in early fall. That's when that van will be used the most. Because they do have a very good vehicle for transportation, they have to go distances and everything.
All right, are we good? Or? All right, our second call to the public, Tom Mankey.
My question is I'm hearing about vehicles and vans and things, and it's like, y'all are in the loop, but us in the public have no idea what you're talking about. And what I'm trying to find out is, what are you talking about as far as, there's a vehicle that they're asking for you guys to take the keys, that it belongs to them, but you're saying it doesn't, or just so that we in the public know what's going on, please, that's all.
We up here don't know everything that's going on either, I'll just add that, so.
Well, let
Madam
me give you
Chair.
a little, Tom, let me give you a little
I was
background.
gonna say the same thing.
Child Services, a couple years ago asked, besides their good vehicle, which we buy every once in a while, we buy a new one, they wanted something for, transport kids for activities in the summer. And so last year, it was the Veterans Office said that they would have one possibly available, and they thought it would be available. And under their old rules, they could probably give it to them as a used vehicle or go to another governmental agency. And that would work good for them. It's mostly used in the summer, late. Anyway. Well, the Veterans Administration changed some rules, so it held it up. So when we were doing budget stuff this summer, we put $20,000 in their budget to buy a used van for that activity. And right after that, it came acknowledged to us that the veterans of the national or state level, whatever, said that that would be okay to give that van to the probate court activities. And so, okay, so we didn't put our money in the budget for a used van. Well, okay, so sometimes the bureaucrats, well, I don't know if you should give it to them, maybe you should give it to somebody else. Well, anyway, they'll get it worked out, and Jeremy put it very, very well. Let them work out the paperwork, and then if that doesn't work out, which sometimes doesn't, and it's no fault of anybody, then like Dan said, there might be something available, probably from one or two different entities, and that will work out. We don't need a new vehicle for that.
Yeah, I think we need to just stay neutral. We don't know if it does, because the DAV could be right. We're not saying every person's right. We don't know. We certainly don't know what the rules in that are. So the DAV could be right, our Veterans Office could be right. We don't really want to be the one that takes the side to push either one, so.
But our main objective is end of school time, summer, early spring, summer. We want them to have a vehicle, so that's our goal.
Yeah, certainly no intentions to any wrongdoing, just wanna support our, probate court and these programs.
There's no hiding, there's no secret agenda, there's nothing like that, it's just one agency thought they could help out.
And I think the loophole came in is our Veterans Office could sell the vehicle, and maybe their misunderstanding is they can't sell the vehicle, but they thought maybe they could donate it.
Transfer.
Or give it to someone, as long as it stayed as part of the government, not just a
An
citizen.
individual.
That might be their confusion, I don't know. They've admitted they're gonna look into it and try to figure it out.
And just to toss this out at you, maybe you might wanna do is talk to the RESD. They got those little micro buses that they bring in and get rid of, and when they get rid of them, it's like 2,000-3,000.
All right, thank you, Tom. I have Les Snyder, you're next.
I'm not even gonna go into the vehicle. It was a mistake on somebody's part, misunderstanding. And it will be worked out. It has been reported to the national DAV. And I was a state commander for the DAV. We're not in the business of giving our vehicles away to any other government agencies. To another veteran service outfit, maybe. But the other is, you know, that's the first time I've ever heard of that. As is just not normal business. I am concerned is with you guys bringing up the idea of reappointing 2 members to the VA board. When I came on board, it was generally understood is that this board wanted to put new members, new blood, on the VA board and move ahead. By reappointing individuals that their terms ended, just ain't right. There was a lot of problems in that office with those individuals on board, and it will just reappear as we need new blood. And some of you, I'm sure, are willing to argue, why am I on there? Because I was on it before. And I've always been a strong supporter of veterans, and I always will. That's why I'm here, and that's why I'm back on that committee, to help veterans. How many times have you seen me in the past come in here on one veteran issue or another? I talked to the chairman the other day, and he said that there wasn't anybody that had applied. Nobody knew about it. It might have been put in the paper, it might not have. It might have been sent out, but I know for a fact, because I'm the adjutant for both the DAV chapter and the regional Veterans Council, we never got a letter. And irregardless, I also submitted a letter stating with, right off the bat, is I've contacted some individuals yesterday. 5 individuals are willing to put in their paperwork to apply for those positions. They've never been on there before, but they have experience dealing with, helping veterans in one way or another. Instead of just blindly appointing that, 2 individuals, I can guarantee there's going to be problems with them. Let's bring some new people in and move on, move ahead. Everything changes, everything needs new blood, as is to keep up with the times.
All right, thank you,
Okay.
Wes. Any further call to the public?
Well, I don't think it's right that at the time we find a list of people and then because we don't like the names, we decide to submit our own later after the deadline. I mean, that's what we've been accused of for years, of just putting our own people. We don't like what the names that come in, so we just put our own people. Here we've got somebody that's doing it. I do take issue with it, them trying to say our executive assistant didn't notify. That bothers me. She did her due diligence, she does it, she's been doing it now for a couple of years. She knows how to send notices out. I mean, the fact that people weren't notified, again, this is our outreach. We outreach to people, we put out there, we put it on Facebook, we put it in the paper, we put it on our website, we send to organizations. The notices get out there. It's not, we can't control whether people reply or not. And then to come in with a list after the deadline because we don't like who the appointments are, then you're putting the board in a position that we've been blamed for being in all this time, that we've been trying to fight out of. That we don't just sit here and backdoor pick our own people because we don't like the certain names. Everyone on this page, you see a bunch of names. Those are the only people that applied for these positions. So it's like, now we're gonna wait till the end until the end and then postpone it and then bring in a list of names that we feel is suitable. I just, we, you know, I don't know. I have no issue with less, but I just, these kind of things that come up, it mind boggling. I mean, where were the names before? There were no names.
Madam Chair,
Yes.
if I could ask a question and direct me mostly towards Chairman Root. Correct me if I'm wrong, but I mean, it's not like these are surprise deadline appointments here. Like, this is a known rotation. This has been known for
Correct.
years that these spots were gonna open up. So the time to have been proactive was no secret, correct? At least the 3 years that I've been on board in December, we do appointments in December for the next year, correct?
Yeah.
Correct.
Okay.
All right, any further comment? No. All right, we are adjourned.